So your point being that you're not cherry picking your best cases from the last 10 years. These are
the consecutive 6 patients. And the first patient just came in this morning, and he had a surgery on Friday.
Okay.
So people that my patients know that I operate 2 days a week. Wednesdays in the OR at Stanford, typically, occasionally at a different hospital, but usually at Stanford. Fridays in my surgical suite in my office. So he had the surgery in the surgical suite on Friday, and he came in on Monday. Okay.
Okay. Very excited to see it.
All right. So he's a young man from New Jersey. He contacted me about 9-10 months ago. He had an MMA for nasal obstruction and sleep apnea. Contacted me three months later and said he's not much improved, a little improved, but still symptomatic. And he can't breathe through his nose. And I said, well, I've treated many patients post MMA, and I'm happy to talk about MMA. I've been doing MMAs for 28 years in practice.
I have some MMA questions for you, definitely.
Okay. So you could see that, left is before surgery, right is after surgery. You could see that there's a little bit of swelling. Okay. And you can see that there's a very tiny diastema. Yes. You can see that he's a little swollen.
So just to be clear, doctor, left is before the E's, right is after the E's.
That is correct.
And just for new viewers, can you explain it like you would to a 4th grader? What basically is the E's? What does that involve for the patient? Why is he a little swollen?
Yeah. E's is basically expanding the midface, nasomaxillary expansion. I'm going to go over the operation.
Okay.
So you can see, I've done a lot of MMAs, and I could tell you that this is not MMA. In fact, I would tell you, and I've done a lot of different types of surgeries in my career. This is not a very invasive operation at all. This operation is less invasive than wisdom teeth removal. This operation is surely less invasive than SFOT. I've done SFOT. Okay.
I have too.
Yeah. So you could see that,
And how about its invasiveness compared to custom MARPI or MSE with the piezo assist?
I would tell you that I've done many MSEs. People that don't know that I've been doing SARPI for 28 years. I stopped doing it. Ease surely is a lot less invasive than SARPI. I would say that the ease is, in my opinion, either the same, for sure less painful than 6 or 8 screws of MSE, custom MARPI, and that sort of thing with piezoelectric. Now, people talk about piezoelectric saw like it's some sort of magic. It's just a tool, okay? You could use how invasive something is. It depends. The device and the tool is the same. It's whoever is holding the device. Agree?
Yeah, sure.
So it depends on who's doing the procedure. Okay. So I would just say that. We could go into that a little bit. Yeah. So left is before, right is this morning, Monday, 3 days later. So Monday, so Friday, Saturday, Sunday, Monday, 3 days later. So you can see that there's a very slight swelling at the labial frenum. Yes, can you see that subtle swelling?
Yes.
Okay. I can assure you this is not MMA post-op 3 days. Yes.
Assuredly.
All right. Now, this patient had MMA. So can you see on the right side that there's a separation of the mid-palatal suture?
I can see it.
This is subtle because I expand at the time of the surgery by about 1 millimeter. Can you see a fine line in the mid-palatal suture that goes all the way to the PNS?
I can, and doctor, also, if you want to highlight a feature of an image, you can put your scroller on it, and we can see your scroller, because others might not be as literate with radiographs as I
You,
might be.
you okay? So you won't see a black line in the middle of on pre-op. You should be able to see a faint black line. I mean, black line on the post-op. Yes, you can see the device. Yes,
right down the mid-palatal suture, there's a black line indicating space.
Yes. Can you see that?
I can see it.
All right. Can you see that it's through the PNS? It's
Yes.
subtle. Okay. Another patient, 25-year-old guy from Australia. He was off. He has nasal obstruction and etc. He has a bit of a crossbite. He was offered to do a 3-piece maxilla orthodontic surgery straight to MMA. He came to see me. And I said, well, if you really want to improve your nasal breathing, I don't think a multi-piece maxilla is really going to do it. We could talk about that. But so I did the E's. So left is Friday, right is Monday. Okay.
I do want to talk about that, by the way, doctor. Let me know if we can talk about that as part of this, or if we should talk about that after you're done with your slideshow.
Let's talk about the end, because
okay.
What I'm trying to, if that's okay. So
that's okay.
You can see, right, it's 3 days later. You can see that there's not much diastema, yes? Not much.
But not much at all.
Okay, but if you can, and can you see that there's a lot of swelling?
Hardly. I mean, to me, if you showed me these pictures randomly, I wouldn't even know really which is the before and after.
The left is always before.
Okay.
The left is before, the right is after. Okay. So look at the overlap of the upper and lower teeth at the premolar and the molar area on the patient's left side, and look at the overlap of the premolar and the molar area on the patient's left side, compare the left and the right. Can you see some subtle width increase of the maxilla?
Yes, I can see
overlap.
Yes, I would.
It's subtle. Okay. It's
less
subtle,
than a millimeter.
I'm sorry?
I would say less than a millimeter.
Yes. But can you see on the right side in terms of the subtle change and overlap?
I can see it.
All right. So, yes? Agree?
Yes.
All right. People, because these patients are blinded in terms of you can't identify them. So people could study them. Okay. So can you look at pre and post? Look, left and right, pre and post. I'm going to talk about pre and post.
Sure.
Can you look at the post-op? Can you see the separation of the mid-palatal suture with the distractor in place?
Yes.
This is subtle that you can't really tell, distinctively that there's the separation of mid-palatal suture from this view. So I present this view. Can you see the separation of mid-palatal suture pre and post?
I see a faint black line in the post photo indicating the separation.
Yes. Okay. And if you look at it closely, you can see the separation anterior to the palatal foramen. I don't know if you can see that. You can blow up.
Can you just explain the anatomy there?
Right, we're looking at basically the ANS, close to the ANS and the from anterior to posterior. So I'm looking at the midline, and you should be able to see that the suture is separated.
Yes.
Small degree, but separated. Yes.
Yes.
Because it's a small degree, but you can see that there are changes in the posterior occlusion.
Mm-hmm.
The width of the maxilla has increased a little between Friday to Monday. Mm-hmm. Yet there's no diastema. Yes?
Correct.
All right. Next patient, 37-year-old guy, sleep apnea over 10 years. And he's from, a lot of my patients are from out of town, out of the country. So he's from Asia, and you could see, compare Friday to Monday, you could see swelling. Yes. You could see some swelling in the upper lip and the anterior nose. Yes.
Sure.
All right. This is not MMA. Okay. So you can see, again, this is subtle. You could see a little bit of swelling at the, above the, can you see a little bit at the frenum?
Yes. And by the
Okay,
frenum, you mean right here, basically.
Yes.
Yep.
Can you see that?
Yes, I can see it. A little
Okay.
redness and a little swelling.
A little redness. Yes.
Yes.
Okay. And can you see the separation of the mid-palatal suture on a 37-year-old guy?
I can see in the right image a black space in the mid-palatal suture on the right side.
No, is that about 1 millimeter?
Not more than 1 millimeter.
Yes, not more than 1 millimeter. Okay, you could see a separation, right?
That's distinct. That's
Okay.
a nice healthy split there.
To the PNS, yes?
Yes, and when you say to the PNS, you're saying to the posterior nasal spine. Is that
That's
what PNS
correct.
means? So you're saying split from the ANS, the anterior, to the PNS, the posterior, indicative of a full length parallel split along the suture. Is that
That's
right?
correct.
Okay.
Yes.
That's important because one of the major distinctions to be made between ease potentially and some of the other nasomaxillary expanders like MSE, custom MARPE, you name it, is, and I want to talk about this more later, do some of the other devices expand in a conical fashion where you don't get the expansion at the posterior nasal spine? You're only seeing it at the front, which is important for nasal breathing. We can talk more about that later.
Absolutely. So, the conical expansion was in my paper, my first paper on ease. Okay. Everybody's talking about it. It's like, okay. So anyways.
It's old news to you. Is that what you're saying?
Well, I see that all the time. I'll just say that.
Okay. We're going to talk more about that later if it's okay.
Sure. 33-year-old woman from Georgia. Unfortunately, she has sleep apnea, nasal obstruction. She had the ELF.
Okay. So she has periodontal issues as well?
Yeah. She had the ELF. You could see before on the left, before you could see the molars are all kicked out. Yes?
Yeah. Some molar flaring from the ELF?
Yeah. By the way, on the right is 2 days after surgery when surgical swelling is maximum. Usually I tell patients they're most swollen about 48 hours after surgery.
I've experienced it. And your point again being that ease is not as invasive as MMA, obviously, which is actually a farce to even suggest that. But, we can see that in the image.
I've heard it more than once. I will venture to say that patients look worse than this after custom MSE and piezoelectric saw separation. But so this is 2 days later. Okay, you can see the diastema. Yes, you should be able to see that. Now you can see the posterior maxilla is expanding. Yes.
Yes.
This was her after. She came in with her ELF. I said, just take that thing out ASAP, like right now in my office.
Did you call it a thing or did you call it something else?
Hey, look, I grew up in Los Angeles, and not the best neighborhood. So my patients know, so it's okay.
Okay.
So you could see. We don't have to harp on that, right?
Okay.
All right. So this is 2 days after surgery. You could see the separation. Yes.
Yes.
You could see the separation to the PNS. Yes.
I can see it when I look closely. Obviously, it's a dark image.
Look at it very closely. Okay, but it's through and through ANS to PNS. 61-year-old. She has had problem breathing through her nose forever. Okay, so you can see she's a little more swollen. Swelling is variable between individuals. I would say this is the worst swelling after ease.
Mm.
Okay.
Mm-hmm.
You can see the small diastema. Can you see that the maxilla is a little wider?
I can see it. Yep.
Can you see the separation of the mid-palatal suture?
Yes.
It's hard to see, but you can, you should be able to. I sort of skewed it a little because if you're looking at straight on, a lot of times you're going to be looking at the vomer if you're looking at it straight on. So I sort of kinked it, tilted a little so you could see the separation. Okay.
Yes,
So
and doctor, just a brief anatomy for the viewers. When you say you're seeing the vomer, you're seeing the bone, which is in the center, the midline. Once you split the suture, there's a bone that sort of lives in the nose. On my skull, it's this. I believe it's this green bone, and so it's like you're peeling the curtains back of one bone, and you're seeing another bone there, which is obscuring the split. Is that what you're saying?
yeah, it's not very easy to tell from in some patients.
Got it.
Okay.
Yep.
All right. Well, this is number 6 patient, I think. Now, she's actually in healthcare, and she wanted to share her experience with a group of healthcare providers. So the photo on the right side is immediately after her surgery.
Same day, you mean, or still a few?
It's right after surgery.
Okay.
Left is pre-op, right is 20 minutes after surgery.
Okay.
You could actually, if you look closely, you could see a little bit of swelling, a little bit of maybe a little residual blood stain. Yes?
A little bit.
You look very closely. Okay.
Mm-hmm.
I could tell you MMA patients don't look like that 20 minutes after surgery.
No, they don't. No, they look like The Walking Dead.
Well,
Too
okay,
much?
we won't touch that. Okay. So you could, now this is Monday. Okay. These photos are, the left is Friday or before surgery, right is 3 days after surgery. You can see the separation. Yes.
And some expansion.
And some expansion. That's correct. You're what I call a connoisseur of expansion, so you can see it.
Sure. That's a first for me, but I'll take it.
Can you see the separation on a 62-year-old? Yes?
Yes.
Can you see the PNS separation on a 62-year-old?
Very nicely on this image.